We've come a long way in the treatment of heart disease. We've seen from the more complex heart transplant procedures to the less invasive interventional and catheter-based approach to advances in medical therapy. It's certainly an evolving field. We've made tremendous progress. I think one of the areas that I'm most excited about is also in the treatment of valvular heart disease. Valvular heart disease is probably one of the most common causes of heart failure. And as you all may relate or can recall, there are 4 important valves in the heart. The 2 most important, I would say, is probably the aortic valve and the mitral valve. And these valves over time will degenerate. They will become affected in many patients. Either they fail to close adequately, and so they leak. And many of you, I'm sure, can relate to that, or they close. So they either become stenotic or they have what we call regurgitation, valvular regurgitation. Both of these conditions typically lead to heart failure, and they become mechanical problems to the heart. Pump and the heart muscle weakens, and patients develop murmurs, they develop heart failure symptoms, and nowadays we can fix these valves with minimally invasive interventional skills. Up until recently, or the last 10 years or so, the only way to fix one of these valves was open heart surgery. So these new therapies that have evolved over the recent past have really revolutionized the way we approach patients with valvular heart disease. Nowadays, we can, under local anesthesia, replace a valve within an hour and a half, with 2 or 3 days of recovery, and essentially no major restrictions under local anesthesia. So compare that to open heart surgery, which is all we had until recently. So these are some of the breakthroughs that we've had, and it's exciting. I think we're going to see more and more of this. Just last week, I did a valve replacement in a 91-year-old. And some would argue, why are we doing this? Well, this patient has the right to live. This patient still wants to play with his grandchildren or go out and play golf. And so there are options now for those patients. And it's great to see how they can spring back and recover so quickly from them.